immediate hypersensitivity of the lung with late phase reaction. It can lead to a triad of intermittent and reversible airway obstruction, chronic bronchial inflammation with eosinophil, as well as hypertrophy and hypersensitivity of the bronchial smooth muscles.
The respiratory system moves air through the nose, pharynx, larynx, trachea, and bronchus to the alveoli where the gas exchange between oxygen and carbon dioxide occurs. Nares are the openings to the nose. The nasal cavity is lined with cilia, mucous membranes, and blood capillaries. The air is filtered by cilia, moistened by mucous membranes, and warmed by the blood. Air moves into the pharynx or throat, the common passageway for food and air. Air continues on to the larynx. The epiglottis, a flap of tissue in front of the larynx, closes off the larynx when swallowing to prevent food from entering. The larynx or voice box contains the vocal folds. The trachea or windpipe connects the larynx to the bronchial tree. The cartilage rings of the trachea prevent the trachea from collapsing. Lungs are spongy tissue with alveoli and blood capillaries. Breathing occurs because of the expansion and contraction of the lungs. The bronchi carrying the air subdivide into smaller branches called bronchioles. At the end of each bronchiole are the alveolar sacs. The alveolar sacs are surrounded by blood capillaries and contain millions of single-layer alveoli cells where the gas exchange takes place. Oxygenated air goes from the nose to the pharynx, larynx, trachea, bronchus, and alveoli. By the process of diffusion, oxygen in the air moves from the alveoli to the capillaries. Carbon dioxide moves from the capillaries to the alveoli and is exhaled. This process is called respiration.
Preservative added into some of the food and beverage included shrimp, processed potato, dry fruit, wine and beer. Airborne allergens such as pollen, animal dander, mold, cockroaches and the dust mite. On the other hand, the menstrual cycle in some women also can trigger the asthma attack. Air pollutant and irritants such as smoke. Dust also can trigger asthma. Certain medications such as beta blocker, aspirin, ibuprofen, and etc. Gastroesophageal reflux disease is also a condition that can cause asthma attack. Physical activity will also lead to exercise-induced asthma. 4A. Respiratory infections such as common cold.
Exercise-induced asthma is asthma that is triggered by physical exercise or exertion. It usually happens 5 to 30 minutes after the exercise has been done and usually have symptoms with coughing and wheezing. This can be overcome by using an inhaler before the exercise even begins. cough variant asthma is where severe coughing is the predominant symptom. Usually, it is a symptom in respiratory infection as well as exercise.
Nighttime asthma, also known as nocturnal asthma, powerfully influenced by circadian rhythm, is caused by exposure to allergens such as chronic of airway, hair position, and common solution causes difficulty in breathing, cough, and wheezing.
Occupational asthma is result of the workplace triggers. It causes difficulty in breathing, running nose, and congestions without a typical asthma wheezing.
Complications of asthma include interfering with sleep, work, and recreational activities, permanent narrowing of the bronchial tubes, as well as side effect of long-term medications such as heartburn and indigestion, brittle bones, as well as increased risk of cataract formation.
How asthma being diagnosed? Asthma can be diagnosed in several ways. The first one is the pulmonary function test using spirometry, and this one is to test how well is the lung function. The second one is the allergy test. This one is to identify the factors that contribute to asthma. And the third one is chest X-ray, basically how any obstruction of the lungs. And the fourth one is the metacholine test. It's same as spirometry, but the patient are required to inhale a whiz that contain different concentration of metacholine. The prognosis for asthma usually is very good. Usually improve over time, even for chronic case. For medical management, it can be divided into surgical and non-surgical management. For non-surgical management, there are usually two main kinds of medication for asthma. The first one is asthma preventive medication, asthma rescue medication. Example for asthma preventive medication are inhaled corticosteroid pill, example prednisolone, and long-acting bronchodilator, for example salmeterol. For rescue medication, example are salbutamol. This is a short-acting bronchodilator. Surgical management is a bronchial thermoplasty, usually indicate for severe chronic case of asthma. And usually a bronchoscope is inserted through the mouth or nose, and along with a wire, the radio wave will heat up the wire so that the muscles surrounding the airway are break up.
Asthma is caused by firstly, breathing is nothing but
The airborne allergies such as pollen, animal, danger, mold, cockroach, and dust mite. Respiratory infections such as
For medical management, it can be divided into for medical management, it can be divided into surgical and non-surgical.
Airborne allergens such as pollen, animal dander, mold, cockroaches, or dust mite.